welcome everyone. Forbes Middle East and EFS Facilities Management have forged a partnership to bring you a special panel discussion on how key organizations have risen to address a few of the more significant challenges and dynamic situations resulting from the COVID-19 situation. I am Lauren Liskey, the Director of Service Assurance at EFS Facilities Management, and I will be your moderator for this discussion. During the last 20 months, many organizations have experienced a rapidly changing world and had a challenging time establishing and maintaining healthy and safe work environments for their employees and the public. Today, we have an amazing panel of diverse health and safety experts with whom we will be discussing how many of the most initiative minds have successfully led their teams to effectively overcome this uncertain and evolving situation. These experts will share with us how a combination of ingenuity and technological solutions have been utilized to provide solutions for us. I would like to introduce the speakers for today and provide a brief overview of their expertise. So first we have John Hewitt. John has had extensive exposure to health, safety, and environmental management in multiple sectors, including aviation, nuclear, oil and gas, education, health and food. Having worked in the Middle East for the past 4 years, he is integrated with the multicultural workforce to enhance safety behaviors, and in doing so, has developed a robust safety culture in his industry. Welcome, John. It's great to have you as a panelist today and enlightening us with your encounters and how you have overcome them.
Thank you very much. Glad to be here.
Next, we have Eric Talley. Eric has 30 years experience in the HSE profession and previously held senior management positions in multiple sectors, with the most prominent being the fields of medical and higher learning. He's had extensive experience planning for and responding to emergencies, crisis situations, and pandemics. Welcome, Eric. Great to have you sharing your experiences and successes with us today.
Hello, Lauren. Thank you for having me here today.
And last but not least, we have Andrew Howell. Andrew has 30 years plus experience in HSE for diverse sectors, including oil and gas, power, heavy civils, infrastructure, hostile country security, power and nuclear operations, and extensive experience regarding loss prevention, disaster planning, crisis management, and business continuity at a global level. Welcome, Andrew. Looking forward to your participation and any insight you can provide for us today.
Thanks, Lauren. Welcome, guys. Good to see everybody.
It's great to have everyone here today, and it's a pleasure to have each of you on the panel, and thank you in advance for participating and sharing your knowledge and experience, as well as welcome to our audience. Without further delay, let me start the discussion and initiate some interesting conversations. So we'll start with Andrew. Andrew, corporations were challenged to provide safety and health environment and revise their approach to health and safety after the outbreak of COVID-19. What were some of the challenges you encountered in the early stages, and what solutions were you and your teams able to develop to address the situation?
Companies and individuals often make decisions based off of significant events that affect them. A couple of ones that come to mind for me were the Space Shuttle Challenger, when it had that tragedy, and then when the Soviet Union disbanded. But I have to say that the COVID-19 plus pandemic is definitely one of the more significant events of my career, in my lifetime. One of the biggest challenges we faced in the beginning was acceptance. There was a certain amount of shock factor, and this isn't going to apply to us, and this is a fade, and it's not going to be anything we're going to have to deal with for a long period of time. As we know, it didn't go away. And once we got past the acceptance factor, we began to try to find information. This was another challenge in itself, starting at the global organizations at the top levels, the WHO, the CDC, many of the government agencies. They had never been faced with anything quite like this, and they didn't know which way to go. We could go on to the internet and contact agencies any day, every other day, and we would get conflicting information. And it was tough to make any type of decisions because the information was not consistent. Once we found several information avenues that we were comfortable with, we began an immediate process of education. And this was the next step before we could apply appropriate controls. In the interim, we are, of course, using the basic controls of the masks, the hygiene, the gloves, the distancing, and all of those type of basic controls. So for us, acceptance was our biggest challenge, then finding accurate information, then getting the people educated in a timely manner, and then putting the controls in place in the first stage.
Okay, well, thank you. It's interesting you raised that because it does kind of look like the 7 steps for denial, acceptance, anger, and everything else is coming about. Next with Eric. Eric, as a director of health, safety, and environment, you're responsible for developing and implementing the HSE strategies and administering comprehensive health and safety programs and policies for your organization. Would you enlighten us how you were able to revise, develop, and implement HSE strategies to ensure they were implemented and a safe environment was the result regarding COVID-19?
Sure. For most emergencies, we have detailed plans and processes that we follow, and HSE is really seen as the expert when responding. The challenge really with COVID-19 is that it was a very dynamic situation, and many things we were learning at the same time the people we serve were learning, and so we had to quickly take that information, digest it, and then give it back to the community in a way that they could use it. So what we wanted was a very strong safety culture. We could make a list of rules. The challenge with that, and especially in a dynamic situation like COVID-19, is that you could list 100 rules, but really what you want is people to think in a different way and accept that the importance of this, so that as the situation changes, they'll change with us. So one thing we saw, because things were changing so quickly, is that the many different departments at our institution were outputting these different requirements and trainings and so forth in their own way, and many of them overlapped with each other. So one of the first things that we did was we brought all those different strategies together from the different departments into one set of guidelines that here at KAUST, King Abdullah University of Science and Technology, we named the Keeping KAUST Safe Guidelines. And so you had one-stop resources for all the information you needed. And then as it was updated, whether it was a human resources guideline on business visitors or personal visitors, we could go and look at that and say, okay, they want to change this guideline. How does that interact with other guidelines that are under this one overarching set of instructions? So that was very successful for us. And then from there, it was a matter of just rolling out the education and training around it. And then also having a mechanism for people to report any issues or challenges. So we made sure that that was available to them as well.
Well, thank you, Eric. I really appreciate that. It's a very informative response, and you're absolutely right. You know, everybody was reacting their own way, trying to resolve it themselves. And it's wonderful that you guys were able to pull it all together under one sort of guiding leadership and get it sorted out. So thank you for that. Next, we'll go to John. So John, managing health and safety has typically been a challenge in the Middle East. The recent situation has evolved from managing people and activities internally to extending to providing and maintaining a safe work environment from external fluid factors and influences. Can you share with us how your safety management system changed and transformed during the last 18 months to address the crisis?
Yes, well, as the pandemic kicked off and the impact of what it was going to do for the company was being realized, we realized that we had to look at ways to make sure that there was no compromise to the business from the employees bringing infections in from the external areas. And this is one of the places where we knew that we can really control. So we had a lot of issues there to actually look at the procedures and things that we had in place to ensure that we managed that as much as we possibly could. So we looked at our management procedures and systems, and we looked at how we could adapt them and change them. And we realized that we didn't really have anything in place to manage COVID. It was something so new and different to us. So we had to look at the procedures, and we collated procedures. We then had to do the risk assessments based on the procedures and what we were seeing happening in and around us, which was an ever-changing environment. And then we looked at how we could control the employees coming into the site, because we could manage just about everything on site. It was obviously coming in from external sources that we had the problems. So we looked at what we could put in place, and we obviously had people who were coming in who were asymptomatic, and we weren't sure whether they were going to be positive or not. So what we decided to do was put in a first line of defense. So we introduced thermal cameras at the gates to try and manage the people coming in as a first line of defense. But with that, obviously we had to introduce new procedures to be able to handle anybody who should have been identified as being raised temperatures or had fever. So we had to look at what we had to do with all our procedures. There was also the element of training that had to come in to do that, and obviously controls that were put in place as a result should there have been anybody who was identified. We then looked at how we could move things forward for infection control, and we then linked in with most of the government bodies in the area. We were lucky enough that we had access to a medical centre so that we could ask for expert advice. And with the ever-changing environment that we found ourselves in, with changes with WHO coming with their information, we had the CDC, as Andrew mentioned, and we also had other information coming in from all different ways. It was very hard to continually monitor and move that forward and make sure that we were ahead of the game. So it was just something that we had to deal with at the time. And we looked at how we could do things to get the employees in, but in a way that we could reduce the volumes of employees coming in and reduce the way that they were engaging outside as well. So what we did was our management systems changed so that we could change the shift patterns, bringing people in at times that where we could control the volumes arriving. So we had to work with our procedures for the management of the bus services and the transportation services, which was impacted more so when the government decided to do their sanitation program. And obviously we had to look at the hours, because we're a 24/7 operation. We had to look at the hours that they were curtailing through the fact that there was restrictions on movement during those periods of time. So we actually changed all our procedures and controls and worked with the bus companies, we worked with the DOH, we worked with the government in ways that we could get the employees into the site. Now, because the restrictions were for non-essential employees and non-essential services, luckily we were one of the services that was seen as an essential service. So we were able to get things moving quite quickly with our liaisons with those departments, but it still didn't stop us having issues with getting certain travel permits for some of the employees. So then we looked at the accommodation and how we could change our procedures towards the accommodation for our employees. Obviously, the employees would leave our site, they would go and interact with all the other people outside of the site, and this is where we saw the potential for infection and infection control that was needed. So we decided to increase our audit schedules, to increase them out to the accommodation. So we sent teams out to the accommodation to do audits to make sure that the COVID controls that we were implementing within the company were then moving out into the accommodation as well. So as it progressed, we managed to continue to look at ways and means of bringing the employees through. Once we got them into the company, our procedures were already in place and we could control the COVID infections and everything there. So our management systems have changed considerably over the last 18 months, and they've had to be very flexible because of the changes with COVID and the waves that we've seen coming through.
Okay, so next we'll go on to technology. Andrew, so you provide health and safety expertise to various industries and corporations. Would you share with us what were or are some of the key challenges you've encountered as the pandemic evolved, and what was the best technological or innovative solutions developed within the health and safety field, along with immediate solutions where there are any long-term solutions to manage communicable diseases or pandemics for the future?
Sure, Lauren. Well, as John had referenced, the first thing we had to do was reassess our risk. Having not had any background or previous experience with this, we began to do risk assessments on our operations in the field, our operations in the main offices, and around our in the environment. The information we were getting was not always consistent, so we had to balance our risk assessment with the information that was available. Once we had a basic TRA or risk assessment that we could work with, we began to take advantage of existing technological options, Zoom calls, remote contacts, cell phones, anything that would allow us to coordinate operations or conduct business or provide communication options without having direct face-to-face were some of the technological things that we worked on. This began to get limited as we moved more into the field and began to start up our field operations again. Many of our locations would not allow cell phones on the projects due to security purposes. They would not allow laptops or computers, so the remote contacts was not available. So basically, people would have to go into the project, clear security, and then come back out to get the updated information. Along with this, we were trying to advance carefully and appropriately our basic initial controls, appropriate masks, gloves, social distancing, the hygiene, and then we were looking at the initial PCR testing that was coming up. It wasn't quite there yet. We had to basically evolve almost weekly, and still we were finding ourselves caught by surprise in many areas. We thought we had everything under control. We had a good couple of weeks. Things were moving forward, for example. And then we, believe it or not, had about 30 positives. How? One of our transport buses had a positive driver. And because of the testing was so new, we didn't know this for some time. And by the time we found out all of these details, of course, we had quite a chaotic quarantine situation.
Yes, it sounds like it. And I think you guys weren't the only ones who encountered sort of situations like that. It's been pretty much the same throughout the entire industry. So thank you for that. Next, Eric. So were you able to utilize technological solutions to help your staff and students learn remotely in the education industry? And how has it helped you manage the pandemic outcome?
Yes, technology for us has been paramount in our response to COVID-19. And there's really two reasons that I think of. One is dissemination of information. So using traditional formats, the challenge is everything changes every day, right? So there's basic messages that we could put out, like wash your hands, wear your face covering, those sorts of things. But the more specific information you really need to disseminate quickly to get it in the right hands and as it changes. And the other is the disruption from our normal environment. So here, for example, in 24 hours time, we converted all of our graduate classrooms from completely in-person learning to completely remote learning. And it was very challenging. We'd never done it before, but we did it. And obviously we couldn't do that without technology. So there are three examples that I would provide to show how we've used technology. The first is transparency. So the use of dashboards. So things like testing results, vaccination rates, those sorts of things. What we found is if I tell an individual, you have COVID, you're positive for COVID-19, and then we do the contact tracing, they inform their immediate people that they were around and so forth. That has a local effect, but really to have that more global effect at our entire institution, we created dashboards. And so people in the community could follow along to see how little or how much COVID there was at the time. And as it increased and people saw that, they began to talk to each other and say, we've got to do more from that safety culture perspective to reduce the numbers. And similar with vaccination rates, we all have people who are maybe they're complacent or they don't believe in the vaccine and so forth. But as they began to see that more and more and more people in our community were vaccinated at all age levels from 12 and higher, it greatly increased the percentage of people vaccinated. The second is we actually made an app called Cow Central, and we put many of the services that we wanted to make available to the community, but in ways that were more COVID friendly, so to speak. Like at our gate entrance into our community, we created a contactless gate entry process where you could go in and fill out the necessary information. It created a QR code that could be scanned from your car and allowed entry booking systems. Basically anything that could go into that app has. And then the last is, as has been mentioned by our other participants, tools such as Zoom, Teams, WebEx, those things that connect us, we could have made some kind of internal in-house solution, but for us, just like everyone else, it wasn't just the internal connection, it was the external connection. We're a large major university that needs to connect to researchers and students and others all across the globe. And so by picking some of these technologies that are very accessible to anyone around the globe, that was really important to our connectedness.
Excellent. Well, thank you, Eric. I mean, I really applaud the fact that you guys created some of this information, posted it for your students stuff, and then they could then communicate that to their friends and families, and it would just, exponentially be communicated throughout from there. So thank you for that. Next, John. So developing technology and innovative equipment has been required to address new problems and challenges brought by COVID-19. Would you be able to share with us how some of this technology provided solutions for a safe working environment for your organization's workforce? And did you encounter any significant challenges that you had to overcome to reshape and restructure your methodology to maintain safe environments?
Yes, I mean, with the onset of COVID, the pandemic started to show that we were going to have to try and reduce how many people were coming into our working environment. So we had to look at the platforms that Andrew and Eric have mentioned there with Zoom and Teams, which were relatively new platforms to a lot of people, and myself included there. So it was something that we hadn't been familiar with, and it was very difficult to start off with to get them to work the way that we needed them to work, to be able to do the communication and keep the teams together whilst they were working from home, or if they had COVID positive, or if they were isolated. So what we tried to do was we made sure that these platforms were in place, they worked, so that everybody had them on their Teams mobiles, if they had them on laptops. So we had to make sure that everybody had access to them before we could actually roll them out. So that was one of the things that started off, and we had IT on board quite a lot to try and help us and work us through the way that they could be utilized better to be a communication platform. And as we progressed from that, we looked at how this was going to affect our employees, with the fact that they were going to have to work from home. They weren't going to be engaging with us in the office. They weren't going to be engaging with their colleagues. So we had to work in ways that we could make sure that there was continual communication between us. Even if it wasn't to do with work, there was a platform there that they could actually contact us and discuss things. So what we decided to do was we put some teams together so that we could keep communication lines open with them at all times, especially for those that were COVID positive, and for those that were in isolation due to travel and due to the close contacts, to make sure that they knew that they were engaged and they were still being thought of and they were still part of the team, and they were being respected as well for the fact that they were a part of a team that was needed wherever they were. So that was part of the technology to move things forward for reduction in staff. One of the other things that we looked at was, as the pandemic started to hit, with waves hitting us, we had a problem with the fact that we couldn't gain the masks that we needed. Because we have quite a large workforce, we needed to make sure that we were providing them with the PPE that they needed. So what we looked at is ways and means of being able to do that, because purchasing, we were having very large difficulties getting the volumes that we needed. So we actually looked to equipment that we could bring in on site to actually manufacture the masks ourselves, which was another avenue which would open up for us if we needed to in the future to be able to sell these externally, because we saw that there was a shortage in the market. So we looked at the equipment that we could purchase, and we went out to the markets and found the equipment that we could use. We looked at the standards and everything that we had to use to be able to manufacture the mask to the requirements, and we bought the kit and we bought it in, and with it came the technology that we could evolve with, but also it had its own issues with regards to procedures, training, controls, and everything else. So basically, we've now got this piece of kit which is manufacturing masks, which we're now making sure that all the internal needs are covered. But also we've now started to sell these masks externally. So we've actually made a revenue generator in this pandemic, which has been quite good for us because obviously with the downturns in business and everything else, it was one of those things that was also assisting us to bring in revenue when we needed to bring in revenue. So it was quite a good piece of technology that we utilized. Now, moving forward, we're now within the aviation industry, we're now looking at the ways and means that we can improve things. And one of the things that we're not currently engaged with, but we're looking at with others, is helmet-mounted thermal imaging systems, so that we can actually control the crowds coming into the airports, the passenger flow, because as it starts to increase within the aviation industry, we need to be making sure that our employees and the passengers are safe. So this kit is already in use in Dubai. We've seen it being used in Europe. We've seen it used in USA. So we're now working to see whether it's something that we could utilize here. But it's just in its early infancy at the moment because the kit is so expensive. But the kit itself is very, very good. And I think that it will be one of the things that we look to the future. With its capabilities for the person, the wearer, to be able to move around. It has facial recognition. It has ability to show temperatures and flag up those that are over the thresholds, and then they can be moved around. But it keeps a safe distance for the person that's wearing it as well. And I think that that's going to be something that we'll be seeing in the future, coming into more areas within the UAE.
Great, excellent. Thank you very much. Appreciate that, John. A little bit of insight into that one, the technological advances and even using it to your benefit. It's just amazing. Next, going on to some planning. So Andrew, most companies have crisis management plans, but I expect that most of these plans did not account for a global pandemic or the scale of the world and the population were impacted. Would you share with us how you were able to guide one or two of the organizations in utilizing, revising their crisis management plan and how it has evolved and changed to be more effective for the future?
Sure, Lauren. Several very famous World War II generals made the statement, planning is essential, but every plan fails with the first encounter of the enemy. And that was basically our approach, our realization when we started planning the COVID-19 plus pandemic into our crisis management plans. We had plans that were functional and we thought had addressed the proper risks through the new TRA risk assessments. But as soon as we began to implement those plans, we immediately found the gaps and the failures in our planning. This was partially due because of the rapid changing for the PCR testing methods. We have locations all over the globe, and different locations would have different PCR testing requirements and PCR testing options. We ran into several challenges with false negatives and false positives, which would then require us to go back and regroup. We hadn't planned for that in the initial crisis management. We built a flexibility factor into our crisis management plans, which allowed for the senior management to be able to evolve both quickly on the ground and then also to impart a lessons learned approach into where we were as the planning process kept moving forward. The lessons learned concept is not new. That's been around for HSE for a long time. Everybody uses a format of lessons learned. The reason it was kind of different for us was because we didn't understand the value of certain lessons we were learning or the need to get other lessons and information involved in regards to the COVID plus pandemic planning. We do have several crisis management plan options, and as they continue to evolve, we evolve with them.
Excellent. Thank you for that. And I think you're absolutely right. You know, you can't plan for everything. You can kind of keep your plans somewhat flexible to adapt as the situation evolves. So thank you for that. Next, Eric. So since December 2020, various entities have shared significant information regarding the pandemic, and strict measures were advised to address and ensure a safe work and the working environment. Some of the initial information provided was not definitive and did not provide accurate guidance on developing and maintaining safe environments. This makes it very challenging for organizations to develop solutions and successfully manage the situations appropriately. Would you be able to share with us how you were able to adapt and overcome the uncertainty by implementing technology or programs to manage the situations? And can you share how that has impacted your crisis management planning going forward?
Right. This is a great question because the response has been so challenging because we had everything from far out claims like 5G causes COVID-19 that we just knew wasn't correct, but there were really realistic issues like, does touching a surface and then someone else touching the surface easily transmit COVID-19, that contact hazard? And we didn't know at first. And the challenge was, what advice do we give? What recommendations do we give when we're still learning some of this information? So here we're University of Science and Technology. We followed the science, but we'd also do risk assessments, like Andrew mentioned earlier, and cost benefit analyses. And so a great example of that is face masks. So early on, we remember no one, many people were not wearing face masks. They weren't widely recommended. Large organizations such as the WHO said, we just don't have enough information yet. Well, we looked at all the factors and we said, okay, so there is some information that shows they could be of value. We don't know definitively yet, but from the cost benefit perspective, if we recommend that everyone wear face masks and it ends up that it isn't a huge benefit, what is the true cost? Well, it was inconvenient to wear a face mask for a period of time until we learned that information. So we made a decision to globally mandate the use of face masks very early in the process. We were, and what we eventually found in that case, that face masks are extremely important in mitigating COVID-19. So it ended up being a benefit. But if it wasn't, we would have just simply removed the requirements since we had more information at that point in time. An example of adapting to the uncertainty is our tiered approach. So all of us, wherever we are, we've gone through this process of seeing everything get bad, and then it gets much better, and we think we're doing fine, and then there are more cases or whatever the issue, and it's kind of up and down, these waves, as they call them, from a positivity rate perspective. And so we really wanted a stepped approach. We use tier levels, and then the highest tier is complete lockdown, which we were in very early in the pandemic, along with the rest of Saudi Arabia. And then the other extreme is new normal. So we're not at new normal. We're actually at what we call tier 1A currently. And through that process, we've gradually gone down in tier levels, but at some point in time, if we saw a number of cases rise or people not following our keeping cows safe guidelines that we discussed earlier, then we backed up a little and said, no public events right now, because when we go to these public events, we're seeing people not distancing the way they should, or whatever it may be. And that strategy that we've been very transparent with the community about, they all know what tier we are. If we go backwards in the tier, they appreciate why we're doing that, and what they need to do to move forward has been very successful for us.
Well, excellent, and thank you for that. And one of the things we did with the masks was we said, it may not be the solution, but at least it prevents people from touching their nose or mouth. And if it's transmitted by touch versus particulates being breathed in, we're reducing that contact. So whatever the case is, whether it was the flu virus or COVID, we had reductions in them. So that was great. Thank you for that. Next, John. So organizations have always had the responsibility of ensuring health and safety of employees in the workplace. Typically, this was a task of the HSE Department, Personnel and Management. Have you had any game-changing workplace changes to establish and promote workplace safety with the recent issues and challenges? And can you expand on how the senior management may have had to adapt to be more dynamic, reactive, and proactive to effectively respond and manage the changing conditions?
Well, first of all, when you say game changers, we have had a little bit of a game changer, but we'll get to that as we go through. But Basically, it's still seen as the HSE sections that are having to deal with the COVID infections for the employees, certainly on the shop floors. And it's been something that's we've had to adapt to ourselves as departments to be able to make sure that we can maintain the safety of the employees. And again, we've been the people that senior management have always had come to for the answers to the questions that they're asking, even though we may not have those answers right there and then. So we've had to adapt and make sure that what the information we're getting from the external sources such as WHO and the CDC and other entities has been disseminated in the right way to be able to make sure that the employees are staying safe on the sites. So what we've looked at is how we can engage the senior management in this. And one of the things that became quite apparent at the beginning was the fact that we were such small teams as HSE, we couldn't do that all ourselves. So what we did was we formed teams with the senior management. So we had HSE and senior managements working together to give communication lines to the employees. As I said before, we needed to make sure that all the employees were familiar with the fact that they had communication lines and they could have access to the senior managers. They could discuss things with the senior managers. So it was something that we set up to make sure that the employee welfare and mindset was being covered. And we gave them opportunities to be able to discuss anything they wanted to, be it work, be it external. And if they were in a position where they had problems with isolation and everything, what we did was the senior managers and ourselves, we made sure that if there was any needs that they had, they could work through up these teams to be able to get those simple things like shopping and medication and things. And through the senior management and teams, we organised ways and means of getting those things to the employees who were having to isolate or couldn't make it into work. So as a result of that, the senior management started to buy into what was going on with regards to employee welfare and the understanding of where the HSE role stood within that. And following on from that, we've now seen that the senior management have engaged more with the employees. They're actually undertaking awareness briefings with the employees out on the floor. And there's been a lot more interaction between the employees and the senior manager levels. And from an HSE point of view, that's a real bonus for us because it means that we're doing what we're doing, and we've also got now more support than we've had before for what we're doing from the senior management levels. And as it progresses, the interaction that we've seen from those levels has also seen a response from the employees in that they can trust us more. They don't see us as the police. They don't see the senior managers as somewhere where they can't go. They've realised that they can, and we've had a major increase in the reporting systems that we've got and the interaction with the employees and their information that they're passing on to us to assist us to improve things for their own well-being and for the company as well. So if you want to say we've had a game changer from this, if there can be a positive from the COVID, is the fact that we have had more senior buy-in from the management, and we understand that the employees now are coming to us more. They're open, they're honest, we're open and honest with them. And this is going to be seen as something that we can work on and move forward into the future to help us improve their safety, their welfare, and their mindsets.
Excellent. Well, thank you very much, John. And it's interesting you say that because, you know, in the past, I've always been a firm believer that knowledge and communication was critical and key to health and safety. Having come to the Middle East, now I have a different take on that, and that is it's got to be the correct knowledge and effective communication, because so many people either miscommunicate or don't communicate the right knowledge, so there's no benefit on that. So thank you for sharing that with us, John. Next, Andrew, if you were to pass on any advice to senior management regarding their crisis management plans, what advice would that be?
Well, I think the first thing that I would do is take a page out of John's book. I'm very impressed that they were able to not only create a new tool and opportunity with the mask production, but they also generated some revenue, which is always a plus. And they created a culture environment where the senior management bought in and took ownership. That would be a huge benefit for any organization, regardless of the base cause. One of the things that Eric had mentioned was the development of technology, the apps, and certain things that led them to also gain a silver lining or a type of a benefit, regardless of what was driving the need for change. I would combine those two basic premises, address the challenge with key accurate information and communication. And then I would continue to be flexible and evolve. My recommendations would be, we've never faced anything like this. We may not ever face anything quite like it again, but it's not going to go away. And it's going to be something we're going to have to face in the future for all of our business decisions.
Excellent. Well, thank you for that. Much appreciated. Next, Eric, do you have any key advice that you can share with organizations to help them to be more prepared and adaptable for future challenges?
The first advice I give is be nimble. So one thing we learned about COVID-19, above all things, is that we had to be able to recognize that the path forward needed to shift or even dramatically change, and be able to make that decision and move forward. Otherwise, we would have gotten too far behind and not able to catch up very well. So that's really important. And along with that, not feeling constrained by our existing policies and procedures. So we know all of us had crisis management plans, all of us had pandemic plans in there, but how many of us really utilized that plan for COVID-19? We threw them out the window and we said, this is totally different than anything that we planned on. So for example, here we follow the normal instant command structure for emergencies and so forth. But this type of emergency was very different, as opposed to being a fire in a building or a flood that affected part of the campus or our city. It was all encompassing. Everything that happened in our institution for a period of time was completely related to COVID-19. So we still have that instant command structure, but we created a crisis center, as we call it, which involves all leadership. And really, it's a fixation on that type of response. And that's what worked best for us. So we didn't feel constrained by any set process that we were following. And the third, which I think is the most important, what we don't want to happen is we get out of COVID-19. Andrew rightfully mentioned that we know we're going to have something else that will be closely related at some point in the future. It's just bound to happen. But overall, we don't want to get out of COVID-19 and not have taken what we've learned and applied it to other things. So there's so much that we've learned. Restructuring, we're seeing just remote work. You know, at our institution, we really didn't have remote work. Now we have a remote work policy, and it's not just because of COVID-19. We've seen some benefits of that, and from a crisis perspective, there are huge benefits that now, if there is that fire in a building and we need all those people to remote work, we know how to do that now, and we can do it very quickly, and they're accustomed to it and know how to do it as well. So really taking all those things we've learned from COVID-19 and applying them in our daily lives.
Excellent. You know, it's interesting that you mentioned some of these things that, you know, how the crisis management centers and war rooms and everything have been developed. When I first went to one of the locations, they had a couple of suitcases that had satellite phones and stuff in case the communications networks were interrupted. And they also had a plan for runners in case, you know, phone services were down. And, you know, now looking back on it, that made a lot of sense. They really were prepared. So thank you for that. Next, John, is there anything you would like to add regarding how organizations can ensure a safe work environment going forward?
Well, obviously, Andrew and Eric have mentioned quite a lot there, and it would be very hard to, I don't want to piggyback on what they're doing there. But for me, I think it's, you need your workforce to be working with you. If you're going to give information and guidance and you want controls to be effective, you've got to make sure that your employees are working with you to be able to do that. And the only way you can do that is to set up some form of communication lines that gives two-way communication between you and your employees. Listen to your employees, hear what they're saying and do something with what they're saying. Because if they're telling you something and you don't do anything with it, it's going to be filtered back and they're not going to come to you again. And one of the things that we've seen, as I said before, is we've seen engagement. And as a result of the communication that's been set up, we're getting so much positivity from a health and safety point of view that it's something that I can only recommend. And on the back of that, we've been working with safety behavior programs, because it's a follow-on for employee ownership for safety. And we've developed these programs, and we've got all different media in and around the locations we have to promote safety behavior, to promote their engagement. And I think that that's been one of the key parts to this, that we've seen that the employees are willing to work with you. They will do what you ask them to do, as long as you make sure that you're telling them why they need to be doing it and the benefits of doing it. And I think that's one of the things that companies, I think, need to be grasping. Your employees are your asset. They are something that you've put so much time, training, and money into. They are something that can give you so much feedback, so much assistance, and help you move forward in a profitable way.
Absolutely. I 100% agree with you that a little bit of information is key to getting things done. People understand why, they will comply. If they don't understand why, they don't see the benefit for it. So thank you for that. Well, thank you very much, everyone. So with that, I'd like to wrap up today's session on how technology and innovation has been used to address and overcome the challenges of COVID-19's constantly changing dynamics. To the people that have established and maintained a safe workplace and protected our coworkers and employees, your actions are recognized and greatly appreciated. Thank you all to our panelists for sharing some insightful views on their challenges and their solutions that they've developed to protect the employees, the public, and to ensure a safe workplace. On behalf of Forbes Middle East and EFS Time and Commitment to join us today, thank you, and we wish everyone a safe and enjoyable day. Thanks.